One of the country's most experienced public health experts says Australia is ill-equipped to handle a serious new threat. Former Chief Medical Officer Tony Adams says there's a lack of specialist medical personnel and coordination for a fast response. Rebecca Barrett reports.
It's the stuff of Hollywood thrillers, a rapidly spreading deadly disease with no known cause or cure.
On day one, there were 2 people, and then 4, and then 16. In 3 months, it's 1 billion. That's where we're headed.
A public health nightmare and one Australia isn't ready for.
The Hollywood scenario in that film would swamp us, I'm sure.
Professor Tony Adams was the Chief Health Officer of New South Wales when the first AIDS cases were identified. He was also the country's top medical officer for almost a decade. The epidemiologist says Australia doesn't have the specialist medical personnel or the national coordination to deal with a serious new threat.
We need to have people that can spring into action, within hours to be the frontline troops.
He says bird flu and SARS provided a worrying insight into the real risks. But this man is here to help, thanks to the University of New South Wales. Dr Douglas Hamilton works at the US Centre for Disease Control and Prevention.
I run a program at the CDC called the Epidemic Intelligence Service. And this is a program that's been around for 60 years, and it trains public health workers to investigate disease outbreaks.
Their expertise was used in the making of the film Contagion. A team of disease detectives, Professor Adams wants ready to respond to real-life emergencies.
We still have an uncoordinated system. We have 3 training programs in various parts of the country. None of them work together really as a unified approach.
I would look at the US experience where we have made the investment, because it is an investment, to train people to do public health and to think about prevention as a strategy and response to emergencies.
An outcome Hollywood would be happy with. Rebecca Barrett, ABC News.